So far in this class, we've looked at a lot of different cell types. We've looked at blood cells, we've looked at nerve cells, we've looked at muscle cells, and we've looked at how they all work together. And one of the types of cells we've mentioned is a very important cell type called stem cells. Stem cells can become other cells. Stem cells are undifferentiated cells. They haven't been differentiated into a nerve, bone cell, blood cell. And these cells are very important, especially lately, because they can be involved in treating diseases. You may recall that one of the promising Parkinson's treatment is to introduce something that helps the body produce new cells that can produce dopamine. And also, you may recall that a treatment for multiple sclerosis involves eliminating the body's own immune system cells and replacing it with cells that then can become immune system cells for the patient. So these are all stem cell treatments that are being developed to help cure diseases. Now, you probably remember the activity we did a little while ago where you thought about your smartphone and compared it to your grandmother's smartphone or your grandchild's smartphone and how you used it. So the exact same cells can become different things, just like the exact same smartphone or tablet can be used in different ways. And if you think about how that works, which programs people put on their phones and on their tablets, you can think about how the cells can have different molecular and genetic programs that push them in one direction or another. The obvious example of a stem cell is a fertilized embryo. So that one cell that has been fertilized with the mother's egg and the father's sperm is now set up to become all the different types of cells in the body, from the brain cells to the bone cells to the skin cells, everything. But they do not have to be that amazing. That kind of amazingness of becoming every cell in the body is called totipotent cells. And some cells are not that powerful. They just become a certain subset of cells, which is called a pluripotent stem cell. And the idea was that in the days when we first were developing stem cell therapy is that we would probably need to use embryonic stem cells so that we can get as much new cells as possible. And those were the cells that were the most important. But it turned out that those cells, those embryonic stem cells, were perhaps a little too powerful. They were able to form too many things, and when they were inserted, for example, in mice to test out different therapies, they became cancerous. So that became a bit of a problem, and yet it helped resolve a bit of a controversy. And this is an activity that you can think of on your own. What might be controversial about having embryonic stem cells to grow, to fertilize human eggs, to make embryos, and then harvest those embryos for their cells? Now, obviously, you can think of a few controversies that might come up with those, and those were the controversies that were faced in the United States in the early 2000s when nonpartisan groups were brought together by the president to try to resolve the ethics of using embryonic stem cells compared to less powerful adult stem cells. Well, since it turned out that embryonic stem cells were almost too powerful to be useful, and there were other issues involved with them, people started using adult stem cells, which are cells that come out of an adult, but you don't have to destroy the adult to use them. And they turned out to be useful also because they could come out from the same person that needed that stem cell therapy. So you can imagine taking some cells out of your own body, using those stem cells to grow a particular tissue type that you're in need of, and then putting it back into your body. That would eliminate some of the problems of rejecting donor organs from somebody else who doesn't have the same level of oligosaccharides, for example, on the outside of their cells. So it would result in less rejection of those cells. So a story that goes along with stem cells that can give you some idea of how these are used involves the story that involves bone marrow transplant. So for example, there have been bone marrow transplants going on for 30 years that have been very successful. Bone marrow is considered a stem cell therapy because even though you're just transplanting something from one donor to one acceptor, those things that you're transplanting contain stem cells. And most of the treatments in the past involved going with a big needle inside of the donor's hip bone. But more recently, donors can simply take a needle into their blood vessels on both arms, and the blood can come out of one arm, go through a machine that sorts out the stem cells, and brings it back in through the other arm. Patients with blood cancers, for example, leukemia, need this kind of treatment. And there are about 10,000 people per year who need it, and 1,000 of them die because they don't get the bone marrow transplant. So this is an exciting new field and an example where stem cell therapy is working very well. And now you know a little bit about it because you're learning the biology of stem cells. If you're going a little deeper, this is an obvious time to read the leaf, What Are Stem Cells?, which gives you the basics of stem cells and shows you an example of the type of stem cells that exist in plants, for example, but then also talks about how human stem cells are used in medicine.